45% of LGBTQ youth seriously considered suicide in the past year. 45% of young LGBTQ people seriously considered attempting suicide in 2021, according to a survey published Wednesday by the LGBTQ mental health nonprofit The Trevor Project. We must recognize that LGBTQ young people face stressors simply for being who they are that their peers never have to worry about, CEO and Executive Director of the Trevor Project Amit Paley said in a statement. With 45% of respondents being people of color and 48% being transgender or non-binary, the annual survey is one of the most diverse surveys of LGBTQ youth ever conducted, according to the Trevor Project. Researchers found that 53% of those who seriously considered suicide in the past year were transgender and non-binary youth, and that 33% were cisgender young people. 14% of LGBTQ youth attempted suicide last year, including nearly 1 in 5 transgender and non-binary youth, as well as nearly 1 in 10 cisgender youth. LGBTQ youth of color considered and attempted suicide at higher rates than their white counterparts, with the highest percentages among Native American, Black and Middle Eastern or North African persons, according to the survey. Bisexual orientation, pansexual young people of color, queer and questioning youth reported higher rates of considered and attempted suicide. Transgender males, non-binary or genderqueer and transgender females considered and attempted suicide at the highest rates. The Trevor Project found that respondents between the ages of 13 and 17 were much more likely to consider or attempt suicide than those who were 18 to 24 years old. Meanwhile, respondents said recent legislation targeting transgender people introduced and passed across the nation has impacted their mental health. And 91% of transgender and non-binary youth said that they've worried about transgender people being denied access to bathrooms due to state or local laws. According to the survey, 93% of transgender and non-binary youth said they've worried about transgender people being denied access to gender-affirming medical care due to state or local laws. They have not only threatened their access to health care, support systems, and affirming spaces at school, they've also negatively impacted their mental health, he said regarding the laws. More than half of LGBTQ youth also noted challenges associated with the COVID-19 pandemic as a contributor to negative mental health, including more than 3 in 5 transgender and non-binary youth, as well as nearly half of cisgender youth. Researchers also found that young LGBTQ people who live in an accepting community reported significantly lower rates of attempting suicide compared to those who do not. The fact that very simple things, like support from family and friends, seeing LGBTQ representation in media, and having your gender expression and pronouns respected, can have such a positive impact on the mental health of an LGBTQ young person is inspiring, and it should command more attention in conversations around suicide prevention and public debates around LGBTQ inclusion, Paley said.